People take drugs to satisfy depression. We are creating a generation of depressed people. There is a part that we are losing many young, reasonable people in the society. The drugs is a weight which will eventually lead you into something destructive. If you get yourself drunk with the popularity you have, you will get to the point that no one sees you anymore, and then you're gonna need something that will make you feel important, and cocaine will give you the best feeling, says Heidi Kabasa. Greetings to each and every one of you, wherever you are all over the continent. My name is Sole Spencer, and this is Teach It with Spencer 007. So I'm saying, and that's what it is. Alright, you're welcome to another edition of our teaching series, and in today's edition, we're going to be looking at the areas of mental health. So I'm saying, we're going to be looking at the areas of mental health, and with the topic, treating things with addictions and substance abuse issues. You start I'm saying? Treating things with addiction and substance abuse issue. You get that? And that's what it is. Alright, before I proceed, I want to first especially appreciate each and every one of you for your time. Thank you for watching my videos. Thank you for your support. I receive your feedback. I'm really grateful. You start I'm saying? I'm really grateful. Thank you, thank you, thank you. Alright, please endeavor to watch this video to the end and make sure that you get the message, alright? Because I'm here to enrich your knowledge, you start I'm saying? And that's what it is. Okay, without any other further ado, let's go straight to the topic, and that's what it is. Few things are as nightmarish for parents as discovering that their teen has been abusing drugs. Individuals who experiment with drugs and alcohol in adolescence are at increased risk of becoming addicted to substances as adults. For parents, it is critical that they understand the signs and symptoms of drugs or alcohol abuse in their teenager. Knowing how best to confront a teen about substance abuse and where to go for help and significantly decrease the risk of a teenager becoming addicted as they aged. Adolescence can be a time of making irrational, impulsive decisions. It can be a time of living in the now, without consideration for consequences that may follow. As a result, it is a time in which many teens try drugs and alcohol for the first time. The average age of substance use initiation is between 13 and 14 years old, in 7th and 8th grade, before one even enter high school. This is a harrowing reality to face. It is difficult to believe that our youth are developing dangerous addictive habits such as early age, especially right under our nose. We want to blame experimentation or the other kids at school for our children's early drug abuse. The last thing we want to uncover is that our children are in danger, or that the substance use is something our sons and daughters have brought upon themselves. As parents and educators, it is crucial that we uncover the root of drug use in teens and young adults as soon as they start to grow. In order to prevent deep-seated drug habit later on in our children's lives, we have to ask questions. We have to understand the problem at hand. We have to have insight into if and how badly this problem could progress. You have just discovered that your teen may have a drug problem. The first thing that you should do is to step back and analyze the situation. Have you found contraband in his or her room? Have you learned that your teen is coming home past curfew, skipping school, and ignoring previous priorities? While these are all apparent signs of drug addiction, they do not reveal the bigger picture of your teen's drug problem. You must now ask questions. In order to find a solution to your teen's drug use, you must grasp the feeling, pressures, and dynamics that lay beneath it. Why do teenagers abuse drugs or alcohol? Why do teenagers abuse drugs or alcohol? According to Olumide, professionally known as Heidi Kabasa, a music producer and a record executive, in his recent podcast on Honest Bunch, he said, and I quote, "People take drugs to satisfy depression. We are creating a generation of depressed people. There is the part that we are losing many young, reasonable people in the society. The drugs is a weight which will eventually lead you into something destructive," says Heidi Kabasa. There are many reasons that teens and young adults get involved with drugs, and unfortunately, there are many instances in which the root of substance use goes much deeper than experimentation. Consider the following reasons that adolescents and young adults use drugs. Number 1, in attempt to fit in. Making friends and establishing oneself at school can be difficult for adolescents. The teenage years often comes with many insecurities, low self-esteem, and fear of not being accepted. In order to fit in, to feel cool, or join an older, more seductive social cycle, many teens will start buying and using drugs. If you get yourself drunk with the popularity you have, you will get to the point that no one sees you anymore, and then you're gonna need something that will make you feel important, and cocaine will give you the best feeling, says Heidi Kabasa. Number two, to feel good. Just to feel good. Many adolescents abuse drugs or alcohol to get high. They are looking for a thrill, an intensified feeling that they cannot obtain through simple pleasure like food or exercise. This is where the addiction cycle starts to kick in. Drugs interact with the way our brain produces and the way our body experiences pleasure. When drugs are used, the brain creates up to 10 times the normal amount of dopamine and euphoria a person should experience. It is unnatural chemistry that takes place, but our brain remembers it. It craves it. Number 3 reasons why teens abuse drugs and alcohol. To feel better. There is a desire to feel good and there is a desire to feel better. These are two very distinct entities when evaluating teen drugs use. Teens looking to feel better are in truth self-medicating. They are battling something deeper than peer pressure or a fake network assignment. Some adolescents are suffering from deep-seated conditions like depression, social anxiety, and stress-related disorders. They use drugs to forget or replace their negative feelings with substance-induced pleasure. Number 4, experimentation. The brain does not finish developing until the age of 25. The last part of the brain to develop is the one that controls rational decision-making, self-control, and judgment, making adolescents more prone to trying risky and daring activities. Drugs and alcohol are often easy, accessible outlets for experimentation. Number 5, competition. The need to perform, to impress, and to make proud is a great pleasure for adolescents and young adults. Whether in school or on the field, young people consistently want to prove they are the best to their peers and parents. The competition to be outstanding, however, can be intense. In academics, for example, teens and young adults often rely on the misuse of prescription stimulants as smart drugs or study aids to improve academic performance. Estimate shows that up to half of all people who enter drugs and alcohol rehab have a comorbid mental health condition that has either triggered their addiction disorder or has worsened from substance abuse. It's imperative that parents get their teens into treatment so they can be thoroughly evaluated and treated for an underlying mental health disorder. What are the risk factors for teen substance abuse? Early aggressive behavior, lack of parental supervision, poor social skills, substance abuse within the peer group, easy access to drugs or alcohol either at home, school, or within the peer group, poverty, instability at home, abuse, academic failure or difficulties, having a parent or caregiver who abuse drugs or alcohol, and lastly, believing that drug use and drinking are dangerous. Every drugs will have a slightly different set of symptoms when it comes to recognizing abuse, but there are overlapping drug abuse symptoms that are present no matter what substance a peer person is taking. They include a sudden change in their personality, moodiness, increased aggressions, a complete change in peer group, increased sleepiness and fatigue, dozing off at inappropriate times, strange smells either on their clothing or coming from bedroom. Why is it important for treatment of drugs and alcohol abuse? Why is treatment important? While it's true that drugs and alcohol affect numerous body systems, they primarily affect the brain, and an adolescent brain is developing and growing through many changes. Introducing substance in the teen years can permanently damage a teen's physiological system. Drugs can deplete the brain of serotonin and dopamine, leading to depression and other mental health issues. Drug and alcohol abuse during the adolescent years will harm a teen's academic abilities and achievements, which can hurt them for the rest of their life. Drugs and alcohol can lead to emotional issues and difficulties regulating emotions as a teen grows. Alcohol abuse in teens can cause memory problems in high scholars. Children who start drinking alcohol before the age of 15 are up to 6 times more likely to become alcoholic as adults than people who wait to drink until they turn 21. Boys who smoke marijuana in high school can stunt their growth. How should parents respond if they suspect their teen is using drugs or alcohol? Before confronting a teenager about suspected drug use or alcohol addiction, it's critical that parents reach out to a qualified drug addiction counselor who is experienced with treating teens first. A counselor can help parents emotionally prepare for the conversation they are about to have with their teen. They can help the family set realistic goals and answer any questions or concerns they may have about rehabilitation treatment for adolescent patients. Having this type of conversation with an adolescent will rarely go as smoothly as the parents hope, but a counselor can show parents the best way to open up the dialogue and how to use disclamation techniques to keep the conversation heading in the right direction. When people who are addicted to drugs or alcohol are confronted with the possibility that they will lose access to the substance, they may panic, lash out, and become unreasonable. Losing access to an addictive substance will cause the person to go through withdrawals, which are often painful and distressing. It is critical that parents are fully prepared with a plan for rehab for their teenager. In rehab, patients have the access to doctors and medical professionals who can treat them for painful withdrawal symptoms. If a teenager knows they will not have to go through withdrawal cold turkey, it can make the prospect of attending rehab less overwhelming and stressful. Since the consequences of teen substance abuse are significant, you must seek rehab for teens at the first signs of a problem. While experimentation may be common among teens, it can quickly become a bigger problem if left unaddressed. When you begin to notice substance abuse, it is time to speak with a qualified drug and alcohol counselor to intervene and address the underlying issues that have led your teen to experiment with drugs. While an intervention for teens is needed at the first sign of substance abuse, in this case, a teen may develop a full-blown addiction, which experts refer to as a substance use disorder. Suppose your teen begins to show signs of a substance use disorder, such as being unable to perform at school because of drugs, demonstrating withdrawal symptoms when drugs are unavailable, or being unable to reduce their drug use. In that case, it is time to seek immediate help. In summary, as I conclude, teens face a different set of substance abuse triggers and influences. Teenagers face a difficult period of time that is characterized by school pressure, social obligations, hormonal changes, and much more. Teenagers often face family or financial stresses as they grow old enough to understand the challenges of life. Teenagers are also faced with the intense pressure of needing to fit in and look cool, which often means abusing drugs and alcohol. Additionally, teens typically go through a phase of rebellion against their parents or attachment figures. Substance abuse is a common way to express this rebellious stage. Because teens are at a vulnerable time in their lives, they may continue to abuse drugs and eventually become addicted. This addiction helps them find control and escape from their external stress and pressure. It's been a long ride, and that will be all for tonight's edition of our teaching series. I hope you didn't give up while watching, and I also hope that we've learned something in tonight's edition of our teaching series. Do endeavor to share your opinion or your thought with me in the comment section below. You get that? Alright, thank you so much for your time as you remain ever blessed. I remain Spencer 007, and that's what it is.